I know. Blood pressure medication can feel like a maze. The names are long, the pills all look the same, and you're handed a prescription with just a few words from the doctor. You nod politely, take the meds home, but deep down you're still wondering, why this drug? Why two pills? Do I really need this? I've met hundreds of patients with that same confusion. There was a woman named Helen, 68 years old, who once looked at me with tears in her eyes and asked, "Doctor, I don't feel any pain. Why do I have to keep taking this?" And I gently told her, "It's exactly when you don't feel anything that the disease is silently working its damage on your heart, your kidneys, your brain, even your eyes." You see, blood pressure meds aren't chosen at random. We, those of us in medicine, choose each one based on your age, your other health conditions, how your body might respond, and yes, even your financial situation. Some meds help relax your blood vessels like ACE inhibitors, but they can cause a dry cough. Others, like IRBs, are gentler, but require careful monitoring of kidney function. Some make you pee more. Some can cause swollen ankles. Each one has a purpose. Each one has a story. I'm not sharing this to scare you. I'm telling you this so you understand. Treatment is a two-way street. You're not just swallowing pills. You deserve to know why. So ask your doctor, take notes. And if something feels off, speak up. Have you ever felt that kind of confusion? If you have, you're not alone. And I'm here to help you untangle it, gently, one pill at a time. Let me tell you something else. Not to criticize, but to connect. Because I've heard these same questions over and over across the decades. I feel fine, so why take medication? That question, I heard it from Joe, a 63-year-old fisherman, strong and healthy, who swore he was never really sick. Then one morning, Joe had a mild stroke. Thankfully, he made it to the hospital in time. Later, he held my hand and said, "Doc, I wish I'd listened earlier." You see, high blood pressure is a silent killer. It doesn't cause pain, it doesn't give you fever, but it slowly wears down your heart day by day, like water carving into stone. By the time you feel symptoms, it's often too late. Then there's this one. My blood pressure is normal now. Can I stop taking the pills? I get that question too. It's a very human instinct. But I want you to imagine this. Your pressure is normal because you're taking the medication. It's like a smoldering fire. Your pills are the water keeping it from flaring up. Stop the water and the fire could surge back, faster than you'd expect. And yes, I've also heard, I'd rather go natural. Herbal medicine must be safer than these chemical pills, right? I respect the desire to live naturally, to care for your body in a gentle way. Truly. But I need to say this clearly. Natural doesn't always mean safe. Poisonous mushrooms are natural too. Some herbs, like licorice or ginseng, can raise blood pressure or interfere with your medications. I've seen patients land in the ER from what they thought was just a soothing herbal tea. I'm not saying you have to choose one or the other, but I am saying be honest with your doctor. If you're taking anything, tea, supplements, herbal capsules, bring it up. There's no shame in trying to care for your health, but your doctor needs to know so they can care for you too. Have you ever had thoughts like these? If so, maybe you see yourself in these stories. And that's okay. What matters most is that, starting today, you begin to understand and take control just a little bit more. Let your medication be part of your journey toward protecting yourself. Not a burden, but a quiet companion walking beside you. And I'm here with you, every step of the way. There's something I've always wanted my patients to truly understand. Though honestly, we don't always have the time to explain it fully in a quick 15-minute appointment. It's this. Doctors don't choose your medication randomly. We don't just grab the first prescription pad and scribble something down. It's not because a drug company advertised it more, and it's certainly not to make your life complicated. The truth is, every pill I prescribe comes after a long, careful line of thinking. I consider your age, because someone who's 55 reacts differently to medication than someone who's 75. I consider your race, because, for example, African American patients often respond better to calcium channel blockers or diuretics. I review your kidney function because if your kidneys are struggling, some meds can make things worse. And I always take into account your medical history, diabetes, heart failure, past stroke. All of that plays into the decision. And you know what sometimes becomes the deciding factor? Your ability to afford it. I once had an elderly gentleman, his name was Frank, who was diligent about taking his meds, but secretly broke his pills in half to stretch them out. He was embarrassed to tell me, but I didn't feel disappointed. I felt compassion. Because medication only works if you can take it every single day. That's why I often choose generics or meds covered by insurance. Same effectiveness, lower cost. And here's something else no one tells you enough. Side effects, if they happen, aren't the end of the road. If a pill causes swollen ankles, sometimes changing the time you take it helps. If it gives you a dry cough, there may be alternatives. Sometimes just a lower dose makes all the difference. But here's the key. You have to speak up. We doctors can't know how you're feeling if you don't tell us. And you should never feel like you just have to tough it out. You deserve to feel comfortable in your treatment, not just managed, but truly cared for. What I want you to remember is this. Treating a condition isn't a one-way street. It's a conversation, a partnership. I bring the medical knowledge. You bring your lived experience. And when those two things come together, that's when real healing begins. So next time you're at the clinic, ask, why did you choose this medication for me? If I have side effects, are there other options? Don't let your treatment be something you just tolerate. Let it be something you truly understand and own. Because that feeling of being informed, in control, and cared for, it's priceless. Now there's one more thing, something small but incredibly important. The time of day you take your medication. This part often gets glossed over during appointments. Doctors might say, take it once a day, or take it in the morning. But sometimes changing just the time of day can make a world of difference. In how well the medication works, how restful your sleep is, how much energy you feel, or how your body adjusts. I remember a patient named Linda, 70 years old. She came in complaining she was waking up 3 to 4 times a night to go to the bathroom. She thought it was a urinary issue. But after reviewing her meds, I saw she was taking a diuretic at night. We shifted it to the morning. A few days later, she called me, finally sleeping through the night. Then there was Gary. He felt exhausted every morning, despite sleeping well. Turns out he was taking a beta blocker first thing in the morning, a drug that can slow the heart and make people feel sluggish. We moved it to the evening. A week later, he called me and said, Doc, I feel like myself again. And some people, especially those whose blood pressure stays high at night, what we call non-dippers, actually benefit from taking certain meds in the evening to lower the risk of nighttime strokes. But that decision must be made with your doctor. It's not something to adjust on your own. I'm sharing all this because I want you to remember, it's not enough to take the right pill. You have to take it the right way at the right time. So next time you see your doctor or pharmacist, don't be afraid to ask, what time of day should I take this? Should I split the dose? If I'm feeling dizzy or tired, can we adjust when I take it? Because your health isn't just about what's on the prescription slip, it's about how you use it and how well you understand it. Think of each pill as part of the rhythm of your life. And when you get that rhythm just right, your whole body starts to move in harmony again. And I, Dr. Robert Williams, I'll be right here helping you tune in to that rhythm, one gentle beat at a time. If you're still here listening all the way to the end, then I truly believe you care about your health. And maybe not just your own, but the health of someone you love too. What I've shared with you today, it's just the beginning. Just a small doorway into the complex yet hopeful world of blood pressure treatment. Because this is only the first episode in a dedicated series I've created. Just for you, for those living with high blood pressure, and for those caring for someone walking that path. In the episodes to come, we'll go deeper together. I'll share real-life stories from my clinic. I'll help you spot the quiet warning signs that are easy to miss. And most importantly, I'll guide you through the key questions you should be asking your doctor so you can better understand and better advocate for your own care. Because I don't just want you to be a patient. I want you to be an active partner in your own health journey. So if you found this video helpful, please take a moment to click like and subscribe to the channel so you won't miss any of the episodes coming next. And if you have questions or personal stories to share, leave them in the comments below. Who knows? Your story might inspire the next episode. I'm Dr. Robert Williams. Thank you for spending your time with me today, and I'll see you in the next video where we'll continue this journey together, gently, thoughtfully, and one step at a time. Until then, wishing you peace, health, and a steady heart.